Good morning. Thank you all very much for joining us today as we are very excited to announce the Newcastle County Police will be partnering with Connections in the pairing of mental health professional and a police officer to create a police alliance team. Please allow me to take a moment and recognize some of the dignitaries that have joined us this morning. Newcastle County Executive Matthew Meyer, Colonel Bond, Chris Devaney, the Chief Operating Officer for Connections Community Support Program, Dr. Joshua Thomas, Executive Director of National Alliance on Mental Illness, and Valerie Tickle from the Delaware Criminal Justice Council. I would now like to turn the podium over to the Honorable Matthew Meyer.
Thank you very much, and good morning, everyone. Good morning, everyone. Good. Got to make sure we're awake. We do this for you, not just for these cameras here. But thank you very much to NAMI, Josh, for coming today, to Chris and Connections, along with our Chief Bond. This is really an amazing model for what policing can be and should be in the 21st century and beyond. Years ago, policing was about sitting, waiting for 911 calls to come in, then you run out, you make arrests, lock people up if necessary, pass them on to the justice system. Today, it's much more comprehensive than that. Everybody talks about community policing, but a lot of community policing, when you get into it, is about mental illness and mental health issues. And today is about making sure that we have the right people on the street working to address those issues, the root causes of a lot of the criminal activity, the lawlessness that can be seen in our county. So we're very excited to have Connections as a partner. We're very excited to be working with NAMI on these issues, creatively thinking about how we can police better. And of course, to have our chief leading the way. I know he believes in this and has convinced me that things like this are really worthwhile. It's important to also note, at a time of what I think our residents know is pretty extreme budgetary pressure, this is yet another example of innovation in our public safety department and in our police department that is not costing county taxpayers a penny in additional county taxes. We're able to do this thanks to the assistance of the U.S. Department of Justice and specifically the Bureau of Justice Assistance. Did I get that right? BJ? I don't know what BJ stands for. Bureau of Justice Assistance. So without further ado, I will hand it back to Officer Eckert to take it from here. Thank you.
Now for a few words from Colonel Bond.
Thank you. Good morning, everyone. I want to thank everyone for being here today. It's very important, I think, that we have this opportunity to pass on once again an initiative from Newcastle County Police Department to help us deal with the community, members of the community, specifically those who are suffering from mental illness. But before I begin, I want to acknowledge some of the people in the front room. Mr. Chris Devaney, I know it's already been done, but Chris, if you could just raise your hand. Dr. Josh Thomas, Executive Director from the National Alliance on Mental Illness. Valerie Tickle, who is here representing the Criminal Justice Council on behalf of Chris Kervek and his staff. Lori Kane, who is here, she's not up front, she's in the back, our in-house grant writer, who played a critical role in us being able to secure this grant. Captain John Treadwell, he's not here today, he's off. Officer Colleen Kearns, who's seated here at the front. And our newest member of Newcastle County, Mrs. Lisa Schaefer, who is our mental health professional that is going to be teamed up or has been teamed up with Officer Kearns. Also would like to thank the county executive, Matthew Meyer, as well as the acting director of public safety, Mike Honicki. But most importantly, I would also want to thank the men and women of Newcastle County Police Department. These are the men and women who are out there protecting and serving our community. Many of our officers are very passionate about this particular topic and the topic dealing with mental illness because we see firsthand the ramifications of it. We see firsthand the dangers associated with responding to calls for service that involve an individual who is suffering from mental crisis. Our officers are out there right now and they're forced to make split-second decisions, decisions that can affect their life from here on out and the lives of those that they interact with. So I sincerely thank the men and women of Newcastle County Police and all law enforcement for having the courage to take on this profession. According to a study by the National Alliance on Mental Illness, 1 out of 4 people killed in officer-involved shootings suffers from a serious mental illness. John Snook, who is the executive director of the Treatment Advocacy Center in Alexandria, Virginia, reported that people suffering from mental illness are 16 times more likely than others to be killed during a police encounter. Another study indicated that 1 out of every 10 encounters police will have involves someone who is suffering from mental illness. In 2017, Newcastle County Police Department responded to approximately 760 calls that involved mental illness. I truly believe that this number is underrepresented because many of the calls that we respond to, while the initial complaint may have been something as simple as a criminal mischief complaint, we can often find that there's an underlying issue of mental illness that's playing a role in this. Not to the point that the officers have to take that person in custody or get them treatment, but you know that something's not right. But we don't capture that. We have a crisis here in Newcastle County. There's a rise in the number of calls for service involving individuals with mental illness. Our primary goal is that we want to go and address these situations, these problems, these individuals without having to use force. And while it may sound easy, it's very tricky. I know case in point yesterday as I was leaving and traveling down Route 40, there was a call that came in at a nearby apartment complex where an individual was inside of the apartment with family members. That individual was armed with a knife. Our officers responded, several officers. We were fortunate that we had crisis intervention team trained officers who responded to that call for service. I wasn't that far away, so I decided that I was going to go as well. I was one of the last officers to respond on scene. Well, when I got there, I could hear officers saying that they were speaking with this individual who was now outside on the balcony and still armed with the knives. As I pulled up and I got out the vehicle and walked up, I saw a few of our officers talking to this individual. They were able to get him, convince him to put down the knives, and they were able to take him into custody. Years ago, I'm not sure if it would have ended that way. It may have been, in the absence of us having a crisis intervention team training, it might have been some type of physical force used on that individual. But that wasn't the case yesterday. And I thought about it as I watched this unfold in front of me, and I thought about the importance of the crisis intervention team training that we received as a result of the efforts of Dr. Thomas here with NAMI, and how important that played out. Because as you listen to the stats that I talked about, you can see that we have our fair share of calls for service that are just like that. And I want to make it clear that no one in law enforcement ever wants to have to use deadly force or physical force. And so that's why it's important that we take every effort we can and every effort that's afforded to us to make sure that our officers are trained. I'm very proud of Newcastle County Police Department for the things that we've done over the last year or so with some of the initiatives. Crisis intervention team training has been going on for the past 3 years or so. I think we started 4 years now. We have 40 officers that are trained in crisis intervention team training, which is basically being able to recognize individuals who are suffering from mental illness, as well as diffuse and de-escalate situations that they encounter. We also expanded beyond that, and Chief Miller has also incorporated some of the police dispatchers so that they are also trained in that. We had earlier this year or last year, Officer Nick Hurst, who recognized that we had an issue with veterans who were suffering from mental illness, those that have served in the military now that have come back. Through his initiative, we were able to start the Veterans Response Team, which is comprised of officers who will have a keen interest in helping other veterans. And these officers are, some of them are active and some of them are no longer in the military, but they still have an interest in helping and serving others. And we've seen a great deal of success from those as well. And those initiatives are great. But I think that this initiative today, what we come to talk about, the Police Connections Alliance, is going to be far-reaching. It's going to afford us an opportunity to provide services to those individuals who are suffering from mental illness as well as their families. The patrol officer doesn't have the opportunity to go back and follow up with individuals who may be being treated but not necessarily following the directions of their doctor, to interact with the families who are often struggling with themselves to try to figure out exactly what to do with their loved one. So with this grant that we have and the people that we selected, Officer Kearns, who has an extensive history and is actually pursuing a doctoral in this area, Lisa, who has 22 years of experience, we believe that teaming them up and allowing them to have the opportunity to go out and interact with the individuals who are suffering from mental illness and then doing a follow-up, it's going to lessen the chances of Newcastle County Police Department having to respond back to that particular address and dealing with that person. Our patrol officers, as I said, they don't have the opportunity or the time. They started actually a couple of weeks ago, about 3 weeks ago. And from day one, we have been assigning them tasks and individuals that we wanted to pay a little bit closer attention to. You know, we have a weekly meeting, our TAPS meeting, where we talk about quality of life issues. And one of the things that comes up quite often is individuals who are suffering from mental illness that have been calling 911 to report issues, or they're having issues reported about them. And in some cases, we've had some individuals call us as much as 20 times a month. And our hope is, and we have done it so far, is that teaming Officer Kearns and Lisa up together, that they will be able to go out, make contact with those individuals, speak with them, speak with the family, and provide them with the necessary assistance they need in order to rectify the problem. This is a positive for us because it builds trust with them, and it also cuts down on the number of times that we have to send patrol officers out to a particular residence. So we're excited about it. I think that it's worthwhile that we announce this to the public, because we want the public to understand that this is a priority for us. I thank you all, the media, for being here today and covering this. In a way, I'm kind of disappointed, I'll be honest with you, and I'll say this. If this was a situation where Newcastle County Police had an officer-involved shooting and that person was killed, and we held a press conference, I can guarantee you that this room would be packed. People will want to report on that. But what's important is to convey and relay information like this and initiatives like this to the public, to let them know what we're doing. I'm grateful that you all took this time and see that this is as important as we do. Thank you.
Next, I'd like to introduce Chris Davini, the Chief Operating Officer for Connections Community Support Program.
I hate these things. I would like to thank County Executive Meyer and Colonel Bond for taking a chance and working with Connections on this project. We have a 20-year history of working with the Newcastle County Police. From our standpoint, the Newcastle County Police, their commitment and their understanding to work compassionately with those individuals with mental illness is not surpassed by any other law enforcement agency in the state of Delaware. And we thank Colonel Bond for thinking outside the box, working with us to pair Lisa Schaefer with an officer to respond to individuals that are experiencing mental health conditions with a hope to divert from incarceration or from criminal charges and to increase opportunities for treatment. The people we will come in contact with are not at their best point in their lives. They're untreated, they're unmedicated, they need help, they need assistance. And the ability to identify those individuals, resolve the problem peacefully, get the person connected with treatment, whether it be in a clinic or in a hospital, and divert them from criminal charges, will prepare them so that they have access to a better quality of life once they're receiving treatment, so that when they go to look for jobs and they go to look for housing and they go to experience the same opportunities that we have, that they won't be encumbered by criminal charges or criminal convictions. So our hope is that as we build this relationship and as we find a way to sustain this past the grant year, that we will have a positive impact and not just reduce the number of calls that the county police face, but also to improve and enhance the quality of lives of individuals who live with mental health conditions. Mental health conditions and substance use conditions are chronic illnesses like diabetes and hypertension, and they require lifelong treatment. So our hope is that as we continue down this path, that we will experience not just, like I said, a decrease in calls, but an improvement in the quality of the lives of the individuals who live in Newcastle County. Thank you. And one more thing, I was asked to inform everyone that Connections has just hired a person to be our criminal justice liaison, and director of criminal justice interfaces and community outreach. So Amy Kivas will be working with the county police and other police agencies throughout Delaware and other law enforcement entities to really try to enhance relationships so that we can continue to help more people who come in contact with criminal justice. Thank you.
Thank you, sir. Now I'd like to introduce Dr. Joshua Thomas, the Executive Director of the National Alliance on Mental Illness.
Good morning, everybody. Thank you so much for the opportunity to be here and to share some comments. My message today is really simple. It is a message of gratitude for this action taken in partnership with Newcastle County government and Connections. It's a great day for Newcastle County and those affected by mental illness and addiction living in this community. The launch of this important mental health partnership adds a critical resource to help law enforcement manage situations with people in crisis. This innovative program will no doubt save lives. We are grateful for the leadership of County Executive Matt Meyer, Colonel Von Bond, for making care for people with mental illness and addiction a priority. Colonel Bond has been a longtime advocate for law enforcement providing dignity and respectful care for people living with mental health in our community. We thank Connections Community Support Programs for their partnership in this endeavor. We appreciate especially Officer Kearns and Lisa Schaefer for rising to this challenge and for their compassion for people who are in crisis in our community. We hope that this is only the beginning of a model of teamwork between mental health professionals and law enforcement who will provide great care for people living in the community. We hope that other communities will follow the lead of the Newcastle County Police Department and Connections in forging these partnerships. I want to say you've heard about the great need in our community already. You are providing hope for individuals living with mental illness and their families by creating these type of partnerships. So we're very grateful to you. Thank you so much.
Thank you, everybody, for coming. Now, Officer First Class Kearns and Ms. Schaefer will be available for any questions. Thank Thank you.